So, Samit, thank you for doing this after such a long time.
Yes, fine.
So this is how we start. We usually start from the very basics. Where were you born?
So I was born in one of the remotest town of Sindh, and that is Badin. Yes. So I was born in Badin, and then my schooling. Maybe it's your next question. My schooling is also from Badin, Sindh, and it was Army Public School. So 10 years of initial schooling were in Badin, and
how were you as a kid? Were you a very silent kid? Were you a very naughty kid?
No, the word naughty was not for me. Being the eldest child in the family, I was one of the most the calm kid in the family, and very obedient, intelligent, and the times when I used to be a little naughtier, I was always brought back to the track by my mother. So सबसे बड़ी हो तो वो role model वाली चीज जो है ना, it has always been there since the beginning.
And then after 10 years, you came to Karachi.
So for the first 10 years of my education, where I was like one of the intelligent ones in the district, I scored position in the metric board exams. Exemplary kid. So I was, then I gave entry test for the Aga Khan Higher Secondary School, which was one of the most renowned or medical college at that time for your intermediate. So I was selected in Aga Khan Higher Secondary School, Karimabad. So 2 years of college education. My pre-medical was from Karimabad.
What made you go towards science or biology?
So if you ask me about my inspiration, what made me pursue pre-medical or medical or science or biology, because since the beginning, whenever you write an essay in the school, you're always asked or you're always encouraged to choose your profession since the beginning. So when I used to write essays in my school life, what I want to be in life, I always used to write that I want to be a doctor. Wow. Maybe that's the profession that where we were always told that this is one of the noble profession. Your textbook, आपके सारे textbook में ही होता है कि if you are someone who is doctor, who is helping people, so that's one thing. And being one of the top achievers, you are already told by the family, by the society, oh, बड़े होके ना doctor ही बनना है. So that's one thing जहाँ पे it was always instilled inside me that आप तो बड़े होके doctor बनेंगे. So I was never introduced to any other profession. जब मैं थोड़ा बड़ी हुई, when I was in pre-med, तो उस वक्त मैंने सोचा, why only doctor? उस वक्त मेरा दिल चाहा कि मैं nutritionist बन जाऊँ, dietitian बन जाऊँ. Allied health मेरे दिमाग में आया कि भाई वो लोग भी तो है ना जो patients की help करते हैं. But then, somehow the pathway was made after pre-med. I gave entry test for medical college entrance exam, उसमें हो गया. So जो बचपन से आपको पढ़ाया जाता है, सिखाया जाता है, you somehow end up becoming that. And also, I have a lot of doctors in my family. So when you are born and raised in a family of doctors, तो उसमें ना आपको फिर होता है कि okay, मैं घर पे अपनी दवाइयाँ पढ़ी हुई हैं ना, तो I used to go and remember the generics and their indications. So I knew half of the medication by the time I was in metric or in my college life. I was aware of the generics most of the time. Nice. So this was something which I was, yes, it was inside.
So, and then when did you go to your med school?
So my med school, I gave my medical college entrance exam for AKU. So from here, the journey of struggle began. When I was in college, year 11 and 12, I gave exam for the Aga Khan University, everybody's dream. So I also dreamt of becoming AKU student. But somehow I got short of few marks and I flunked that exam once. So after that, I chose not to stop there and I was selected in public sector university, and that was according to district-wise quota. I was chosen to pursue my education in People's Medical College, Nawabshah. So my initial 3 years were there in Nawabshah, and after that I got migrated and I later continued my education in Liaquat University, Jamshoro, Hyderabad.
And then while you were doing your med school, So how was the journey, number one? Number two, what made you think यार मैंने gynecologist बनना है? This is something that I can pursue.
Okay, so
उसके भी बाद इंटर्नशिप में identify हुआ.
no, एक तो पैशन के चलो मेडिसिन करना है, डॉक्टर बनना है. It was always there since the beginning. Women health, what particularly inspired me to be a gynecologist, it also started while I was in medical school. While learning about anatomy of female pelvis, या कुछ भी हम करते थे ना, I always used to shine out while being in gynae rotation or anywhere. तो सारे class fellows ना उसको भी कहेंगे तुम gynecologist बनोगी. Not that I have that strong personality or what, but वो एक interest होता है ना which speaks aloud. It always stood out of me. तो उसमें जो है, my class fellows recognize that, okay, I have my interest in that, and then you do projects more on that field. और उसके अलावा, I have role models in my life, and I started going to conferences related to women health, in gynecology conferences. So I attended most of the conferences related to women health, and that inspires you to be on that track. क्योंकि आप जिस field में सबसे ज़्यादा जाते हो, आप उसके बारे में पढ़ते हो, and then you want to be in that field only. And then I was very bad with physics, so and मुझे सब family ने कहा कि gynae is, you should not do it because there is no work-life balance. And I was told to do radiology, to do dermatology, to do anesthesia. People think that these fields are comparatively easier than gynecology. But I do not believe that. मेरा जो I will talk on that. But मेरा जो आपका होता है ना कि all my basic sciences were stronger related to female pelvis, and I felt that this is my calling, and I work best in that field. So that's how I chose gynecology. So talking about my internship experience, so after I finished my medical school, my internship experience, I applied for internship here in Aga Khan, and I was selected. And during my internship experience, the first 3 months were in pediatric surgery. And then later 3 months of surgical rotation was in gynecology. So those 3 months in gynae rotation were challenge. It was difficult to adapt to this environment, but there were things, and there were good mentors, there were good supervisors who always encouraged me to pursue this field. I still remember one of the chief resident at that time in 2013. She saw me very much interested in this field. So there were residents who were not happy during their rotations and all. She used to come and tell me, इनको मत देखो, do not take inspiration from them. ये इस वक्त ना मजबूर हैं, तो इसलिए जो है ये इस फील्ड को enjoy नहीं करते. But you should do gynae. So I am thankful to that chief resident. I still remember her. She used to come and wake me up at 6 in the morning to do all assessments of laboring patient. So it started building from there. Okay, I need to focus on my specialty, and gynae came from there. So the internship period, it ended up happily. I then did medicine rotation, ER rotation, and then at the end of your internship period, by December 2013, I knew that I have to go for gynecology, and there is no other field. Although my personality was so bubbly and jolly, people would think that I would come back here and do pediatrics. But no, I think it's much easier to work in the field which has been there in you since the beginning. So gynecology, that's how it came to me.
And then mashallah, you did your residency from here. How was the residency experience like?
So once you have entered in AKU, Aga Khan University, I don't think you would want to work anywhere else in Pakistan, because it's just how the system is built up here. I chose to do my residency here, and the experience of residency has been amazing, because I was trained under maybe 25 consultants, and all of these consultants are trained from UK. There are board certified US trained consultants. So the training, the sort of training that I received, I think it's par excellent, and if you compare it with anywhere else in the world in terms of gynecology and obstetrics, we are comparable. We match to these international standards. years. So the experience of having 4 years training of residency training of Obs and Gynae at AU, it's been marvelous.
And then, mashallah, say now you're attending here. How does that feel that medical student who was rejected here is now
Oh, yes. So somewhere I think it feels rewarding that one time that you would want to be a student here, and now God has beautiful plans for you. If I was rejected to be a medical student here, I feel somewhere God wanted me to be the faculty here to teach those medical students. So it feels amazing to be the teacher of those students who are rotating with us. So you never know what God has planned for you. So I feel very happy, mashallah.
Going back to the first point that you made about work-life balance, likewise you said that you don't agree with that, right? Pehle to tell me what is work-life balance, number one. Number two, or is it just some vague definition that we have of work-life balance?
No, I definitely believe that in 24 hours, you need to have some part of that 24 hours to yourself, some to your family and society, and there should be some chunk, maybe a greater chunk, towards your career, towards your patient, towards your job. So if I talk about Obs and Gynae, because the pattern of work in Obs and Gynae is different from all other fields. We take care of a woman who is pregnant, and they tend to stay in touch with a consultant who knows them throughout their journey of pregnancy. So if she comes in labor, I have to be there for her, be it at midnight or early in the morning or in the late night hours. I have to be there for her. So when you are working in OBGYN, you cannot work on your conditions. That okay, I am not available.
I'm sorry, continue.
Yeah.
What I believe is it's not just like rows and it's not a 7 day of my time is work-life balance. It can be 1 hour, one day, it can be 3 hours another day. It depends on how your working schedule is, right?
So in the initial years of training and being early career faculty, it is a little tougher. As the time passes, you understand your work dynamics, your work ethics. So somehow you channelize that, okay, out of 7 days in a week, I keep 1 day to myself. So a lot of people, they are doing it like this. On Sundays, kuch bhi ho jaye, main available nahi hu. You can contact on call. But then you need to have that rapport with the patient. If she comes on Sunday, patient should know that her doctor will not be available. So I think this goes on with time. So starting from the residency years of Obs and Gynae, it is tough. Thanks to the new work policy that residents cannot work beyond 20 certain period of time, so they cannot extend that hours. But in our time, we used to stay back post-fall till midnight, so sometimes it used to stretch us to 48 hours as well. So now it has changed. So still, OBGYN is one field where you find it difficult to have that work-life balance. Especially if you're working in a teaching hospital. Private practice is entirely different. You can set your work hours, you can go to your clinic at 10 in the morning, you can adjust your work hours if you're working private. But then there are advantages and disadvantages of both work models.
You also talk about how you've been mentored by a lot of people. What do you think is the definition of a good mentor? And how can somebody be a good mentor? And uske baad I'll ask you, what should mentees look forward?
If I am a mentor, what would be an ideal mentor? If I am a mentee, how can I be an ideal mentee? So mentorship is a concept where you try to help a mentee in achieving their objectives. A good mentor should listen, understand, and then help you navigate through your objectives. Okay? And at the end of that, the purpose of this whole mentorship is that to meet the objectives of your mentee, to help them meet their objectives. So that's what a good mentor is. It's not that a mentee should never expect their mentor to be doing work on their part. A good mentee is someone who should have open communication, who should set and meet deadlines of your meeting, and they should always be present on their scheduled time. So a good mentee is someone who would actually show their passion, that they are passionate about their objectives, and they would push the mentor to help them achieve those goals. So this is what I believe in, and it's a bi-directional, it's a mutual relationship. Mentor is also getting something by helping the mentee work towards their goal, and mentee, he or she has to achieve their goals. So if you talk about being a bad mentor or bad mentee, so bad mentor is someone who would not keep the interest of their mentee ahead of anyone else. I strongly believe on this. And then they should have, mutual understanding of their decided meeting times. They should meet whatever timelines are set for that. And then bad mentee is always someone who would schedule the meeting but would not attend because of other commitments. Yeah. So that's how.
I think that's very well put, and that's how a mentor should be. I would like to have those mentors, and then a mentee is how that's.
So being a junior faculty or president, there is this good concept of mentorship in our university now. So somewhere we are being benefited by that program. And it's just an amazing concept where the senior faculty helps junior faculty in achieving their goals in due course of time. And that's really helpful.
It's sort of a buddy system.
It is. But now it's a formal relationship. It is on the paper. So that's amazing concept.
So, mashallah, you're doing well. What is one message that you'd like to give other budding residents or gynecologists or interns who are listening to you? What is one thing that they can get a message from you?
So my journey, although I don't find it very inspiring, but somewhere I think that if you struggle, if you put your all at one place and focus on achieving your objective, number one, there is no shortcut to success. I may have taken longer time than other people, but at the end of the day, I am satisfied where I am. This is where I was meant to be. So there is no shortcut to success. If you are taking time, if you're taking longer time than the others, that means you're learning more than others. You may fail a few more exams, but at the end of the day, if you're achieving your goal, that is it. That is it. You know you have made it. So for all young people who want to come in gynecology, it is a challenging field. If you want to pursue this field, make sure that this is your passion. It should not be the dream of your amma abba. वो एक जगह पे होगा. लेकिन अगर आप उस पे नहीं है, you cannot work on that. You're not motivated enough for that. You're not dedicated enough for that. Do not do it forcefully. Never do things forcefully. कि मुझे उसके लिए करना है, मुझे उसके लिए करना है. नहीं. Do it for your own self. If at any point in time, in early years of your residency program, you feel that this is not your cup of tea, leave. There are other options, and it's perfectly all right to be flexible enough to take decisions and change your career pathways. At the end of the day, you should not be depressed. You should not be burnt out. Give some time to yourself. Travel, read, and eat. And then work.
Thank you. Thank you so much for doing this.
You're welcome.